We're going to try to define what is meant by core, how we should approach it from a distance runner perspective, and then combining the healthcare side plus the strengthening side to kind of come to some common ground of how we should approach training. And then applying it into your everyday routines, because we have to understand the purpose of what we're doing if it's going to be effective. Just because core work or crunch exercises or planks are beneficial at either stabilizing or strengthening the spine doesn't necessarily mean that every day we can implement it. We have to have a timing of when we incorporate certain types of stimulus. So how do we define the core? Muscles surrounding the torso is typically what people think of as the core, but there's a lot that goes into it. It's not just abdominals, not just lower back. Scapular motion has an effect on how our lower back and trunk will function, just as much as hip and pelvic control. So core muscles are geared towards being position sensors, where our body is in relation to space. That's what proprioception is. When we think of balance, that's where it's a proprioceptive activity. We're trying to maintain our body's awareness of where we are. It's also trying to help stabilize the spine. So when we run, the core acts as a corset. It functions together as one total body unit to help increase intra-abdominal pressure, stabilize the spine, so that we can generate a lot more force when we transition from one limb to another limb. So when you think of it in that concept, we don't necessarily want to be doing isolation work, meaning crunches, because you're trying to get whole body movements, you're trying to get a coordinated reaction between all these different muscles to, one, transfer energy, to absorb force, and to generate enough mobility at the pelvic girdle so that we can move forward effectively. And to prevent injury. I mean, there's a lot of studies that have shown dynamic pelvic control and hip control affects the way our lower limb kinematics work. So proprioception is important, but it shouldn't be the main focus when we're talking about core work, because we're getting that a lot when we run already. We're on an unstable support. Proprioception is very important when you're talking about a rehab situation, when someone is coming back from an injury, because a lot of that gets compromised in that rest period. So reintroducing some of that initially, if you have an athlete coming back off of, say, shin splints or IT band or patellofemoral, some of these injuries that we'll talk about later this afternoon, proprioception is important. But when we're doing proprioception out at, say, our practice, I'll have them run barefoot around the turf. We'll do some balance work, but the balance work is on a stable surface. And we'll talk about the difference between a stable versus unstable surface as it relates to a training stimulus. But at the same time, you need some of that proprioception, but you're getting plenty of it already when you're running. Okay, traditional ways to train the core. How many of you guys do crunches? You don't have to show your hands because I don't want you to be embarrassed. I hate crunches. I mean, we don't do them. We try to keep things in a spine neutral position. That's why we do a ton of plank exercises when we're out at practice, because it's a lot easier to manage that neutral spine and avoid some of these disadvantaged loads on, say, the disc or some of these passive structures like the ligaments or the joint capsules that potentially could be compromised if they're sacrificing form in order to complete the number of reps or the time that we outline for them with that routine. So keep that in mind when you're developing your programs too, is that the kids are tired, both mentally but also physically from sitting all day. You need to have appropriate progressions with your exercises, but also appropriate number of reps and time doing a specific load so that they're not sacrificing form or posture in order to complete that task.